All right, I just sent a note to Dan, but we've got a quorum, so we will get started. I'll call the meeting to order. Uh, no changes to the agenda. Is there a motion to approve the November 8 meeting minutes?
I move we accept the minutes as written.
There's one typo,
Is there?
yes, in under activity reports, that Mr. Wonder thank the board, it should be thanked. So with that change. The second page, just a spelling.
So I'll make a motion to approve with the aforementioned amendment.
Anne, will you second?
I second.
All right, all those in favor say aye.
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 All abstain since I wasn't at the meeting.
Great.
Okay.
I will do.
All right, do we have anybody for public comment today?
No, I didn't see it.
Is it 3 people in there? There's Dan.
Yep,
Awesome.
Dan's on now. But there's nobody in the room.
No.
Okay. All right, no unfinished business, so we will move into new business. So Charlie and team.
Yes, and good morning, everyone. You have the October 31st financial report and the November 2024 preliminary report. To start out with October, going over the key metrics page, we have a bank balance of $463,000, and we're in compliance with reserve requirements by almost $49,000. Financial summary for October alone: revenue about $215,000. We're going to reduce that by salaries and wages by $151,000 and operating expenses of $31,000, leaving us a surplus for the month of October of almost $32,000. Now going fiscal year to date, so July through October, revenue $485,000. We're going to reduce that by salaries and wages by $476,000. And operating expenses of $121,000, leaving us a deficit through October 31st of 2024 of almost $112,000. To compare that to budget real quick, revenue is 3% below what we budgeted. Salaries and wages, 4% more than what we budgeted, and operating expenses 5% above what was budgeted. Comparing it to last fiscal year, if memory serves me right, we're very comparable. Yes, so like I said, we're about a deficit of $112,000. Last fiscal year, at this time, we were at almost $118,000 deficit. So very comparable. Accounts receivable, $280,000, almost $281,000. $171,000 of that is related to West Virginia Treasury alone.
How much? Sorry.
$171,000. Any questions on the October 2024 financial report?
Got it.
We'll go into the November preliminaries, and then we can, in case there's any questions with regards to the 2 months, and then we'll entertain a motion to accept the October financials.
All right, November 2024 preliminary. This first part, to tell you, I'll go over the reserve, but I also have an update as of earlier in the week. So we're 42% through the year as of November 30th of 2024. Bank balance almost $350,000. And we are not in compliance with reserve requirements by $109,000. Yeah, it's a flip. And I think we're gonna see another one. That's how we're trending at least. As of December 11th of 2024, we had a bank balance of $479,000. So that would put us in compliance with reserve requirements. Financial summary, November of 2024 alone, revenue 43,000. We're gonna reduce that by salaries and wages of 110,000 and operating expenses of 21,000, leaving us a deficit for the month of November of $88,500. Fiscal year to date, revenue $528,000. We're gonna reduce that by salaries and wages of 586 and operating expenses of 142, leaving us a deficit through November 30th of 2024 of $200,000. Comparing that to last year, we're doing about $38,000 better. Double check that. Remember get mine. 37,000. Better than we were last year at this time. Comparing that to our budget, revenue is 9% below budget. That's very on par with the prior years at this time. Salaries and wages 4% above what we budgeted, and operating expenses 2.5% above what was budgeted. Accounts receivable, that went up a little bit, $298,000. 171 still relates to West Virginia State Treasury. That is 58% of our balance.
What was the revenue for last November? I mean, this is obviously.
Yeah, so, last November, it was, give me one moment.
Sorry.
So last November, revenue was 466,000.
Wow.
Total income this year, $528,000.
That was year-to-date revenue.
This year to date.
Yeah, but I'm talking about
The month.
the monthly.
The monthly.
Because it's only 43 here. Is
Mhm.
that normal? I mean, pretty much just
November is usually a very
a
slow
up,
month
yeah,
for
right.
revenue.
Okay. So we're looking at seasonality.
Yes, and we're hitting, our mid fiscal year, we had our little bit of a slump. We have a little bit of cyclical.
So the year-to-date revenue was 400.
Yeah, so year to date, last year, $465,000 compared to this year, 528. That's a 13.5% increase over last year.
Right, okay.
So we're actually slightly ahead of last year.
Yes, top line,
That kind of
yes.
even build state aid for Q3 yet.
And maybe this will put some of the operating expenses in perspective. So operating expenses, 142,000, 61,000, that's vaccine. So that's money we've expended, but maybe we haven't realized all the revenue yet.
Any other questions for Charlie? Is there a motion to accept the October financials as presented?
I move we accept the October financials as presented.
One
Do you have a
second.
sec? Thank you, Elliot. Any discussion? All those in favor say aye. Aye.
Thank you for having me today.
Thank you, Charlie.
Thank you. Merry Christmas.
Merry Christmas.
Yeah.
Merry Christmas, Charlie.
Merry Christmas.
Merry Christmas.
I'm flipping between documents here, so give me a second. Okay. All right, we'll move into the agency activity report, starting with Brandon on threat preparedness. I'm assuming Brandon's in there.
Yes, I am. Yeah. First, I just wanted to mention that the Colorado trip went well. It was a very good learning and networking experience. I was able to get some good connections, like some connections in the public health department in Frederick County, Maryland, and also get some connections for grants for the health department as well. Leading into that grant thought, we are looking into getting a grant through the CISA for the health department to see if we can get some more funding for things like rebuilding the website or updating the website. Looking to get some new computers, new Wi-Fi, stuff like that. And hopefully that'll all be funded through that grant. So besides that, I think hopefully looking forward to maybe getting that grant and hopefully using it to fund a lot of stuff in the future. That's about it.
What's the timing on the grant, Brandon?
So the deadline is April. I'm hoping that we can get in before then. We're currently working on it. We're putting together the application. I'm doing some mini risk assessments. Hopefully we should get it done. I'd like to get it done by February or so. So we'll have to see. Sometimes those timelines get a little bit mixed up, but I'm hoping that we'll get it done by then. So.
And you had a survey on site and telephone
Yeah.
survey.
We did have some, couple, federal employees from, CISA come out, did an inspection, physical inspection of the building. And another one was a virtual one where, we just basically went over a bunch of questions about the network and the, basically the network infrastructure, the building and the OT system.
And you had mentioned we have to get another company, find a company to do some.
Yeah, there's gonna be a few contracts with different places, especially for the website. For the Wi-Fi, we already have a contract with another provider. We might need to look for another provider. I'm not sure yet. We haven't really figured that one out yet. But yeah, for the website for sure, we will definitely have to be looking into a contract for a company that can help us with building the website. We currently have someone, but we're thinking about that.
Had you mentioned to me that we had to have someone do a survey or an assessment somewhere? Misunderstood.
Yeah, so they are doing they're doing a couple other things, like a vulnerability scan, a network penetration test. They're doing a bunch of different things, but yeah, there are they still have a few other things that they have to come in and do before we can get the grant. But for the paperwork wise, we're getting most of that done now, yeah.
So how would the Wi-Fi change?
So currently we have a Wi-Fi through Comcast. It is an older plan, if I remember correctly, and it's only supports like 5 people or so. And it kind of goes in and out, shuts down because we have some critical stuff like data loggers, stuff like that on there that we would be amiss of if the Wi-Fi went down. So we're just kind of either looking to upgrade that plan or possibly go with the state's Wi-Fi. We're not really sure yet what we're gonna do. But hopefully that will be funded and paid for through the grant as well.
Is the state's Wi-Fi available here?
Yeah, but they have to come out, they'd have to put it in, and basically whenever they do Ethernet, it has to be rewired and they'd have to implement it into the actual health department. So it won't be a quick thing, but it'll be something that will be well needed, so. But that's what they're going to do.
Great, thanks, Brandon. All right, next is environmental activity report.
So at the beginning of November, we did have a sanitarian leave us. So that dropped us down to 3 sanitarians and myself. Overall, the numbers have been pretty steady. We're not really seeing a decrease in our septic applications, which normally around this time of year, that area starts to slow down, depending on weather, obviously. But last few years, it's been pretty steady. So November, we had quite a lot of septic visits, a couple complaints, and a lot of finals scheduled. So with that being as heavy of the schedule with one person out, it definitely put a little bit of a strain on the department. Today is actually another sanitarian's last day, so that'll drop us down to 2 sanitarians and myself. There is a little bit of a plan for that. I'm gonna go into the field a lot more. I'm gonna start on septic rotations and complaints myself. Obviously with that, it's going to probably lead to some delays and things. So we've been kind of telling the public, expect a little bit of delay. You might not get a phone call back, right away, but We're gonna try to provide the same level of customer service as we have. It's just gonna be a little bit of a strain, until we can get some hiring done. We do have, that position has been posted. It closed this week. We have candidates and we're in the process of hiring those candidates. It's just gonna take a little bit of time, so we'll see how that goes, but, last month, we also did experience it wasn't necessarily a foodborne illness outbreak, but it could have been. And we were able to go through the steps of tracing back an epidemiological investigation, collecting stool samples, doing a routine inspection, and conducting interviews with employees. So it was a really good exercise for us to go through all of the steps of an outbreak investigation, and we followed all the procedures and it went really well. The state determined that there was no outbreak and the facility was perfectly in perfect operation, so there was no issue, which was fantastic. Other than that, I don't really have any other updates other than we did submit the environmental grant. That's the same grant that we had the last 3 years. We applied for that funding again for the next 3 years. I won't have an answer of if we were awarded that at the next board meeting. It's supposed to come in around January 14th or 15th. So I will probably have an update on that in the February board meeting.
Good question.
Mhm.
There's a lot of new development going on.
Yes, there is.
And are those homes mostly going on public water or are they going on well and septic?
Yes, the majority of them do not have access to either public water or sewer, so it would be well and septic for each lot.
And we have to inspect each one.
Mhm.
So what's your backlog?
Actually, we are hitting our goals for well and septics. That is the priority, making sure our permits are getting out within 20 days of application. So far, we have not had permits go out late. But on the same dime that we're getting our permits out on septic side, our food inspection backlog is growing. So there are food facilities that generally are the lower risk ones and our general inspections like hotels that we don't need to be in more than once a year that are starting to fall a little bit behind.
So your applications for some replacement sanitarians, would they already have a West Virginia license or have to go through all of the training?
So we would absolutely welcome somebody that has a West Virginia license. It is a rarity right now there's an extreme shortage of sanitarians in the state. So there was one candidate that did apply with the West Virginia license and I scheduled an interview with him, but he did not show up. So all of the other candidates would have to go through the West Virginia training. So it would be about 6 months before they would be able to start working in the field.
What is the nature of, you mentioned there are a couple of complaints on septic. What's the nature of those complaints?
We have an ongoing complaint about an illegal septic and a septic system that was installed illegally. So we've been trying to coordinate with that individual to obtain the proper permit for that system. And then there is another ongoing complaint about a septic failure. So somebody's neighbor's septic is failing. So we're trying to get that repaired.
What happens in the event that the person that illegally installed a septic, what happens in that case if they don't do it?
So generally we would send out a letter that states that that individual has 30 days to obtain the proper permits. And in the event that they don't, it would then elevate to our prosecuting attorney and potential prosecution. But generally, we try to be very flexible because we understand that with septic systems, there's quite a financial impact to the person. And a lot of times it's not that they don't want to fix it, it's just that they don't have the means. So thankfully, West Virginia has a couple of good loan options and some grants for those individuals. So We have supplied that information to this individual and we are just kind of waiting for them to comply.
Is it
Interesting.
a health risk for this to be failing?
It is. And it can potentially contaminate groundwater, which is the biggest concern. So if that sewage is left untreated, then obviously you're gonna see an uptick in waterborne illness.
Any other questions for Alexis? Okay, then I think we move on to clinical.
So on our medical team, we haven't seen many changes. Family planning, all our programs, breast cancer and cervical cancer screening, sexual transmitted infections, vaccinations. We're right on par. There's not much going on right now to actually report. Things are steady. But if you have any questions, I'm more than happy to answer them. The numbers are pretty much where we expected to be at this time of year.
Do you have any updates or any updates on our, is it QRT, the quick response team work that you all have been doing? How's that going? So on and so forth.
They're doing very well. We are in the process of changing a little bit how we're doing things. We've been involved with the drug court team. We are going to take a step back and focus more on other tasks that we have at hand right now. They're getting very busy and we got to prioritize where we're going to put our efforts into. And we're also considering a third part-time peer recovery coach in the next upcoming January, if possible. But we're still trying to figure, is it really feasible? Do we need it? So we're just doing some little changes, but nothing big too.
Mention what changed on the grant.
Oh, yes, the grant money has been decreased. We had around $50,000 decrease than we had last year. So there is a shift in what we're gonna expect to get. And I think Gino can speak more to that since he manages the grant.
So quickly, last year, we spent about $177,000 on the QRT team and QRT program, of which all of that was reimbursed by the previous fiscal year 24 grant. That has cycled off. We've applied for the fiscal year 25 grant. We have received not confirmation yet, but that it is looks like it'll be accepted and that we should be receiving a full copy for signature within the next few weeks. That total on that grant now is about $676,000. And so it's in line roughly with what we spent last year, and we should know soon. Unfortunately, we're obviously incurring cost that has not yet been able to be reimbursed. So we've already put in more than 1 quarter into the QRT team, and we're not able to have, I have not been able to bill for it yet, but we will be able to. So.
Have there been any updates on the what is it called? The First Foundation, the opioid settlement money, sort of where does that stand today?
So they had their meeting yesterday, which I think in the next day or two, they should have on their website who got the awards. I'm not sure. It's a little hard sometimes to follow the meetings. I did listen to it, but hopefully we'll know in a day or two, because JCCM, I think, was the main one submitting it. They may get notification initially. So hopefully we'll know soon, one way or the
So
other.
did we partner with JCCM for the grant?
Yes, for both the county and the county funds, and then the First Foundation, because it would be a joint venture trying to work on different aspects of the needs of the population. They have social workers and other support staff. We have peer recovery and clinical services. So
All right,
this
I guess
definitely requires a team.
yes, yes. Well, I think with that, we can move into your report, Dr. Rudy.
Okay, so just a little more on the QRT. I'm still discussing with the prosecutor the issue of getting information from EMS about the names and locations of people who have been seen for suspected overdose and survived. One of the quick response team is that they're to try within 72 hours to meet that person and see how they can assist them, ideally getting into a recovery program, but in any other ways they can assist to try and help them deal better with this. There are over 120 EMS responses for suspected overdoses a year. And we're not getting that information right now. That has to do with questions about the confidentiality of and who can share it without written permission from the individual. So that's something we continue to work on. Other things going on, of course, this is respiratory season. It is the season. We've already had this week. One of the schools is having some flu cases. If you look at the map, the national map on flu is always at least 1 week behind, just gathering data. And mostly the nation has been in mild. The most recent map I saw, New Jersey is in high, high number of cases. Maryland and Virginia are moderate, but West Virginia as a whole, so in theory that includes us, is mild, but I think we've moved into the moderate. And that's for flu. COVID continues, and probably everyone continues to hear of people they know socially who can't attend an event because they've come down with it. RSV, is also the season. There's also this year been an increase in mycoplasma pneumonia, which is a bacteria. I'm not sure if there's an increase or if simply the technology to measure it is now at a point of care thing that ERs and urgent cares are now able to detect that that's why this person has a respiratory infection. So that's something I've been hearing about at the state level too. So there are a lot of different respiratory illnesses. The guidance is pretty much the same for the 3 viral infections. As if you're sick and you have a respiratory infection, especially if you're feeling bad, you have headache, fever, you really should stay home from school or work until you're improving and not having fever for at least 24 hours. That's a lot different than the 10-day quarantine with COVID before. Unfortunately, even if everyone stays home for 10 days, we've learned this from COVID, is that because with RSV, COVID, flu, you can be infected and not have symptoms or have such mild symptoms you don't know. So only keeping symptomatic people away doesn't prevent the illness from spreading. Same with hand, foot, and mouth disease in preschools and stuff. Also, if you would close schools, it's not going to keep people home if they're feeling fine. So there's there could be times when a school or business would close just because they don't have enough staff to do everyone's too sick. But most people get over these things pretty quickly and should be back in at their activity in just a couple of days. So I don't anticipate this is going to be different than every other year. We're going to have seasonal increases in these respiratory viruses. And then we get 2 weeks off for Christmas, which in theory with schools closed helps, except everyone's traveling and moving around. So I don't know what happens. I don't know what strain of flu is going around. It's still not too late to get a flu shot for those who want, because sometimes there's another flu peak from it, so there could be influenza A now. It could be in 2 months there's influenza B. So the flu vaccines include 4 different strains of flu. The have had few cases I've been aware of HIV, new cases of HIV lately, who have history of drug abuse. So injection or even nasal inhaling with straws is a way that HIV is a bloodborne pathogen or body fluid pathogen can be transmitted. Same with hepatitis C. One of the ways to try and prevent that is trying to get people to, well, obviously to stop using. It would be ideal, but for those who are, if they at least aren't sharing syringes, having clean syringes is important, but there are restrictions on how they can be supplied. Berkeley County does have what's called a harm reduction program, which part of the harm reduction is, if you're using, is you want to decrease the harm, is have fresh, clean syringes. And so Jefferson County residents can go there and get it. Hagerstown has one also. For us to do such a thing would require that we be licensed by the state to do it. It would also require the county commission to approve it and to maintain their approval. And if it was in a municipality, the municipality would also have to approve it. So from asking people, it doesn't sound like in the past or presently that we have support to do that. It's quite a lot of effort to do such an activity, but it is important. We are seeing a few people with hepatitis C for treatment. West Virginia has the greatest per capita number of cases of hepatitis C, which is often transmitted through blood, through needle or other sharing. And hepatitis B also, we have the highest in the nation and have for a couple decades. So I've seen a few people starting to get some referrals. The treatment for hepatitis C has changed dramatically in the last 15 years. 10 years ago, it was shots with interferon and pills, and it was 6 months or more. The medication made people feel awful, and it may be cured 20% of the people. Now it's once a day pills that are 2 to 3 months, have very few side effects, and cure 98% of the people that complete the course. And the price has come down from $50,000 a treatment to probably about $14,000-15,000, and it's covered by most insurance companies. So it's difficulty becomes treating people who are in a social state of, in a psychological state that they can actually complete 3 months of treatment without stopping. So that's something we're trying to do. We also would get paid by Medicaid or their other insurance for seeing them and treating them. It's actually not really hard. So we potentially could see quite a few people for that. Untreated, it's about half of people with hepatitis C get chronic hepatitis C that over 20 or 30 years leads to liver failure and death. So there's no urgency in treating it, but you do want to get it treated. And that to me, a lot of people on liver transplants are just dying. So I think that's the biggest issues on the clinical side.
So did you say we are treating people with hepatitis C or we're not?
I am, yes.
Okay.
So it's it used to be that general doctors couldn't, that they said you had to be infectious disease doctor or gastroenterologist. Over the last 5 years, they've loosened that up. Still, most doctors are not doing because it's just not in their comfort zone. It's but that is, in my comfort zone, and it's clearly a public health issue.
Any questions for Dr. Reedy? All right, we'll head over to Gino.
Very quickly, I've been closing out all the grants, all the old stuff, making sure all the old invoices have been paid. That's a lot of what's been coming in and making the bank balance stay nice and high. There's only 2 outstanding payments from West Virginia Treasury that total about $20,000 that will be over 180 days. So that will eliminate a lot of the accounts receivable amount, or lower the accounts receivable amount, which has been going down. Financially, we're doing okay. We are ahead of last year. Year to date, I did a analysis very quickly yesterday morning just to see where we are. We're about 40 to 50, almost $50,000, $47,000 ahead year to date versus where we were last year. So that's nice. But other than that, that's all I have. Everybody else covered everything else that I would have said if it hadn't been covered. That's it.
Well, can we talk a little bit about the operating expenses, because that's been sort of in the 2 financial reports that we got. We have operating expenses that are running higher than budget. Do we expect that to start? A, do we expect that to start to come down? And B, what is it that we're overspending on?
So over half of operational expenditures so far this year have been vaccine. So hopefully we can realize revenue based off the purchase of those vaccines over the course of the next few months. But generally, yes, I have been much tighter on operating expenses and have had to nix some things that otherwise would have been allowed in previous years. So I am keeping a very good eye on discretionary spending.
Any questions for Gino?
It's a good question.
All right. So we have on the agenda another item regarding a personnel matter that Dr. Reedy would like to talk with us about. I'd like us to go into executive session for that. However, we are waiting on Nathan to join us. And I think, Dr. Reedy, did you say he's going to be available around 10 o'clock?
But he'll be coming in before then. Brandon's not going to be able to join us.
He's not going to be able to join us?
No, I'm asking you.
Oh, yeah. I
Yeah.
think he was going to try to join around 10 o'clock. So what I'd like to propose is that we go into recess until Nathan and Brandon are able to join us. So it's 9:38 right now. So we take a 20-minute recess and reconvene.
Okay.
So I'll put the motion. I'd like to motion to put us into recess until 10 a.m.
That's
Second.
All right. Any question or any discussion? All those in favor say aye.
Aye.
Aye. All right. We'll be in recess until 10 o'clock.